Hello, hi guys, welcome to the Docs Podcast. Dr. Aly here.
And Dr. Ingky, welcome to the podcast to medical doctors. Sometimes talk about medical, sometimes non-medical. And for this week, Dr. Aly is presenting.
Yes, so this week I'm going to talk somewhat medical, somewhat career and commerce. So at least career, more so to speak. Now, Ingky, I know you and I were quite fixed in our roots, and we've discussed this before, and even on air, that highly unlikely you would be migrating. True or not?
Yes, that's right. That's right.
That's quite true, right?
That's
and the same for me. Highly unlikely that I would want to even consider migrating. However, it is not uncommon for a medical doctor to consider migration.
Medical doctors
Correct.
to consider migration.
Migration.
Okay.
Like it or not, let's call a spade as a spade. You know, working conditions here, for the same amount of brain that you use, the amount of remuneration, compensation
okay,
is at ringgit, which even if you do dollar for dollar, you are 3 to 6 times lesser than your counterparts.
That's right. And that is just financial remuneration.
That's just financial remuneration.
Right?
We're not
There's
talking about your quality of
things.
life. We're not talking about the taxes and everything. We just talk very surface level. If I'm going to put out so much of effort in this country, I'm going to put out the same effort in the other country. The amount that I'm receiving is going to be much lesser in terms of the total value. Hence, there is always a bit of a encouragement for people to seek migration if the remuneration is worth it.
But currently, you make it sound like doctors are only chasing money, right? It's like, hey, that country is paying me more, I'm going there.
Yeah.
So doctors are money-minded people.
They are.
Well, doctors are just humans.
They're humans.
Right. At the end of the day, you're just
at the end of the day, you're humans. Yes, you are doing something that benefits the people, but at the end of the day, you also want to be remunerated for the amount of time that you put in, the amount of investment that you put in terms of your time to come back.
Okay, so you mentioned that doctors are more highly likely to...
No, that was just the crux and the prefix. Right. Now, let's talk about the real issue here.
Okay.
Why, if you are a parent, or if you're a doctor, or if you are a parent, whatever it is, try not to make your kids into a doctor if you think that they might migrate.
Okay. But let's talk about that first.
Let's talk about that.
No. I want to talk about why.
Why?
I want to talk about then what is the percentage of doctors migrating out of Malaysia?
Oh, it's actually not that high.
Okay. I mean, compared to if you compare to the population norm, is it at the population norm or a little bit higher?
I think it's way below population norm.
So to be honest, most doctors don't actually migrate, but there are a handful of doctors who will migrate now.
Now the issue is not that they don't want to, but it's difficult to.
How? What do you mean it's difficult to?
Because of migration requirements and also licensing requirements.
Okay.
Hence, if migration is something that you are considering for your next generation, let's be honest. Again, I'm going controversy today. There will be parents who are looking out for their kids and thinking of migration as something that they are looking into. Doctors is probably the lowest of the medical profession you want to put them in. Nurses, on the other hand, will have a higher chance of migrating than doctors.
Yeah. You are right. It's and majority of the time is because a lot of countries, all right, they control the amount of doctors being produced because you want to control overproduction.
Correct. You need quality.
You need quality, right? You need quality, and you want to make sure that they are trained in your university, in your syllabus.
Yes.
Hence, that's why they make it difficult for an outsider to come and join in.
That's absolutely right. That's absolutely right. So, fact number 1: for a doctor to migrate versus a nurse to migrate, a doctor would have to understand a disease of a geographical location.
Yes, correct.
All right. For example, we talk about cystic fibrosis. Not here.
Yeah, rare, very
but
rare.
in your medical books, right?
It's always there.
It's always there. However, very rare.
Yeah.
Dengue, not there.
No,
but it's very common here.
Yeah.
Malaria is very common here, but it's hardly in your medical books.
Yes, it's hardly in the medical books.
Hence,
Tropical diseases are rarely touched upon. We have probably like a few chapters.
Segment only.
Yeah, but when you're in Malaysia, you see almost every day.
Every day. TB is an issue here. However, over there, somewhat, but not a big issue.
Over there, all your multiple sclerosis.
Correct. Multiple sclerosis, your cystic fibrosis becomes a big issue. Hence, for a doctor to migrate, let's make it easy. Malaysia to UK or Malaysia to Australia, two most common places. it's difficult to get in because the syllabus that you study in, it's already not compatible.
That's true.
It's like saying Windows versus Mac OS. However, you can still get the job done, but they need to pre-qualify you.
That's right.
So then they'll put you through another exam.
That's right.
Then they'll put you through another fellowship. There is a possibility that you might be a very qualified doctor here, but you still need to go there, and you still need to serve and be an understudy.
Yep, that's right.
Right? So hence, that's number one. It's actually more difficult. Whereas, as a nurse, your syllabus is patient care.
Yep.
Very structured.
Yep.
Very universal. And hence, to move about, regardless whichever country, their syllabus and their requirements are less stringent.
Yeah, you're right. And also because a lot of hospitals, are understaffed with nurses, and they require nurses.
Absolutely right, which comes to point number two. Point number two, for every doctor, the ratio doctor to nurse is between 5 to 10. So, if a hospital has 100 doctors, you need at least 500 to 1,000 nurses. So the chance on the shortage and also the need of it is always going to be higher as a nurse compared to a doctor.
You're right.
So again, it's a supply and demand thing. While there are a lot more nurses being churned out, but once you go, it's talking about skills. And again, if you're a doctor, you want to migrate, also talks about skill. You can't be just a simple doctor and look forward for migration. It's a bit more difficult. So if you're still going to put up the same amount of work and you want to migrate, a nurse demand is way much higher because there is a larger need compared to a doctor. Any hospital that opens up will have a 5 to 10 nurse to a doctor ratio. So their requirements are way much higher.
That's true.
Right. Fact number 3 is what Dr. Ingky said. Every country will still want to protect their local doctors first. So it's scarce. And even though if they're having shortage, they will rather pump and churn more locally than to accept a foreign labor.
You're right. A lot of countries, even despite shortage of doctors, they rather wait to train their own doctors internally. They wait for 5, 10, 15 years.
Correct.
And then only once they have sufficient, then after that, then they will have sufficient doctors. And even some countries, right, they make it very difficult for you to even apply for job. Example, if you're in the EU. If you're not an EU citizen, your chances of getting a job as a doctor in the EU is close to none. It's close to 0%. Correct. And they make you really jump through hoops.
Yes. You literally have to be a circus animal. You have to do a lot of things just to get in. And once you're in, your hopes of being in a city hospital is close to zero.
Yep. And you're also there on a contractual basis. That means that
at any point of time, they can just say,
you.
We don't need you, please go.
Correct.
So that's another issue. Even if you're going to Australia, you probably have to serve in rural for a couple of years first. So you're not going to go there, from a first-class citizen here. You're not going to be a first-class citizen there. You're going to have to serve a little bit before you can slowly upgrade your position back. Whereas a nurse, if the city needs you, the city needs you.
Right.
So there's nothing to worry so much about it. All right. Finish 3. Point number 4 or 5, doesn't matter. The next point, let's keep it easy. Countries who require labor, especially shortage of labor, will actually do active recruitment, and nurses are always on active recruitment. They actually will advertise and say, we need 50, 100 nurses in the UAE, in Dubai, in Australia, in the UK, or in the US. When's the last time you heard of active recruitment for doctors? They
are, but probably even if they want to recruit, it's very small cohort,
very specific to the specialty that they need.
Correct.
If you talk about a general doctor,
highly likely,
highly unlikely, no. Right? Okay. Next point, probably 6 by now. For a nurse to do a post-basic, it's way much easier than a doctor to do a subspecialty.
Yep, that is true. Because in the medical training, in order for you to do a subspecialty, a place must open up.
Yes.
And these places sometimes don't open up for a couple of months to a couple of years.
Correct.
Because they might have the resources to only train 5 doctors.
5, 2, 3, 4,
Yeah,
5.
2, 3, 4, 5. And until one of these 5 doctors
Graduates.
completes training,
Then the space
right?
opens up.
Or then that one space opens up.
Yep.
Otherwise, the space is closed.
Yep. So hence, your opportunity for specialized training, which the next host country wants a specialized doctor, is very limited. Where else for a post-basic nurse, you're talking about from a general nurse, and let's say she wants to do an ICU. There's a lot of space.
Yeah, there's a lot of
She
space.
wants to do dialysis. There's a lot of space. All right. Even if, let's say, it's not that much, but 80 versus 5 is way much more.
Yep,
Your chances of getting in is way much higher. All right. So there you go. That's another one. Now, the rest of it, right, it's actually not that much one. So some people talk about language. Do you know language for nurses is actually not such a high requirement?
Yeah, most countries when they actively recruit nurses, right, they don't really expect you to speak the local language.
Correct.
Right?
Correct.
Basic English is
English.
English
IELTS
can
is
really
enough.
Yeah, IELTS is enough. English is enough.
Whereas as a doctor, it's different.
It's a doctor, they expect you to speak the local language fluently.
Try going Russian, right?
Yeah. It's the same thing. If you go to any part of Europe, right, in order for you to even sit for the medical board exam, you need to pass the language exam. So basically, right, you have to go to like places like France or Germany, take their language test, pass it first, then only are using that to then qualify to sit for the medical test.
Correct. Whereas for nurses,
Nah, it's not necessary.
not necessary, because a lot of it is charts.
Yes.
A lot of it is following procedures.
That's right.
And a lot of it is just following a set protocol that has been set in the nursing fraternity. So in a way, right, in some obscure sense, right, this nursing fraternity is way much more organized than the medical fraternity.
Yeah, they
In
are.
a way. All right. Now, let's talk about remuneration as a nurse. So a lot of people say, nurse, how much can you earn, right? I got some facts here. If you intend to be a nurse in the US, your average only, not talking about your specialized salary, your average salary is between 75 to 80,000 USD per year.
Now, you might think that, doctors make more, but have to remember one thing, your student loans are almost none, very low.
Correct.
As a nurse, right, your student loans are low. It's like maybe 50 to 100K, all right? If you're a medical doctor in the States, your student loan when you graduate starts like $500,000 to $1 million.
Come on, we talk about Malaysia, who's going there.
Okay, all right.
Medical doctor, how much is it? Local.
Local,
We don't talk about local university. We talk about let's say private university, local one.
Okay, let's say private university, local one. Yeah, I would say in Malaysia it will cost anywhere between
300,000, 400,000
about 300,000 to $500,000 ringgit.
Nursing
is about probably less than 100 these days.
80,000?
Yeah, 60,000-80,000.
So you see, right, even your loans, right, is very much different already. And if you go into the US, 75 to 80,000 US dollars a year, that equates to about 350 to 375,000 ringgit a year. That equates to about 30,000 ringgit a month. Pre-tax.
Now another good point of studying nursing is the course is shorter.
Yes.
In a couple of years you're done. Now to be a doctor, right, your course is so much longer. So
then your specialization.
Then you specialize. So that's why.
And then you still need to sit for their certification.
Then you need the certification, and after you graduate and start working and making the money, you have to pay back the loan.
Correct.
All right. So, but as a nurse, you graduate, you study a couple of years, you graduate, you start paying your loans early.
Yeah.
Right. By the time this medical doctor is halfway through, your debt is gone already.
You're actually profitable.
Yeah.
You're
exactly.
a profitable person. The doctor is still chasing after his loans.
Yes, that's right.
Or at least paying back his parents or whatever the way is. Right. Next, in the UK, 25,000 to 35,000 pounds a year. That equates to 146 to 200,000 ringgit a year. Or 11 to 16,000 ringgit a month. And the popular one that a lot of my nursing friends also went, Dubai and Saudi.
Yeah, Dubai and Saudi pays a lot.
So Dubai and Saudi, okay, it's average about 10,000 ringgit a month.
Yep.
The advantage about Dubai is
It's
tax-free.
Even in Saudi, it's tax-free.
Tax-free, so you earn dollar for dollar everything you bring home. Plus, they provide accommodation for you.
Let me tell you a nice story about this staff nurse that I know.
Okay.
That worked in Saudi. So this staff nurse I know, she was in Saudi in one of the major pediatric hospitals.
Okay.
In Riyadh. So one day, the Sheikh's son. The
like the Prime Minister punya anak lah.
It's like the king's anak lah. It's the king's anak.
Okay.
One of the Sheikh's son was admitted. All right, wasn't feeling well. Admitted. Small boy admitted. All right. So her department or her wing, all right, her ward was in charge of him. All right. Of course, they were in charge of a few other patients as well. Now, after a couple of days, Sheikh's son recovered and was discharged. The Sheikh was so happy, whereby the Sheikh rewarded everyone with a 1-year bonus. Everyone in that wing, right? Everyone that took care of his son, he gave a 1-year bonus.
That's the fun part about Saudi lah.
I was like,
these weird things can happen. It's like the other day, this footballer just got a Rolex watch for no reason.
Oh yes.
And then there's another clip I watched on TikTok. This kid who managed to meet the Sheikh or the Sheikh's son and said, "I wish to have a Rolls Royce, a Mercedes," and immediately they just approved, and the next day he got it.
Yeah,
it's ridiculous.
Yeah. So the perks of working.
There.
in the Middle East.
Closer to home, Australia. It's about 65 to 85,000 Aussie dollars a year, which works out to be about 200 to 200,000 ringgit a year, and that works out to be about 18,000 ringgit a month. So hence, as a parent, even as a doctor, if you're looking out and you're considering, again, I'm saying this somewhat a bit controversial. People can say I'm encouraging brain drain. No, I'm only considering future planning, because whether I say or not, you're going to do it anyway. Do look into these factors, and if you want your next generation to move abroad as a medical professional, I would say a non-doctor will have a higher chance to give them the kind of life that you think they deserve.
Interesting, right? All right, interesting.
Till then,
hold on first. Hold on first. All right, this is the end of the month already. All right.
Yeah.
I kept my facial hair so long.
All right.
And you don't want to talk about it.
Ayo, you caught me lah.
Beginning of the month, right?
Anyway, this month is November.
Yeah.
And I was the one who prompted that let's keep our beard for the whole month.
Yeah, man.
Yep. So November, there's this movement called Movember. Movember.
Okay. What's a Movember?
Movember basically is mustache on November.
Okay.
So are you gonna grow mustache? Shall we do the whole non-shave November thing?
I can, but alright.
Caesar's trim, but no shave.
Caesar's trim, no shave.
Right?
Okay.
We'll do this November challenge.
Okay, Ken. I think it's doable. Let's see at the end of November how.
I think November is fun. We're gonna grow our facial hair. We're gonna trim. We're not gonna shave. We're gonna try the whole November. I think his wife is gonna complain and say, "You are crazy fella. I'm gonna make my husband do this for you."
Well, it'll be fun because I've never actually left it too long. Right? Usually on a once every 3 days, I'll actually go and trim it. So okay lah. Let's see.
Let's see how far we go. So guys, enjoy Movember. Grow your mustache. It's got absolutely nothing to do apart from joining us for the fun of it, and we will see in the next couple of episodes how we look like, how scruffy and unkept we look. Thank God it didn't say don't shave, don't cut hair. So it's only just
it's just the facial hair. Okay, right. He ambushed me on air,
Yeah,
he said,
I ambushed him on air.
Let's keep our facial hair. I was like, what?
Can you zoom in?
Okay.
Can you just zoom in right now and let's see his beard? Just zoom in. Let's bring in.
Okay,
let's give him due credit.
Give me due credit, okay?
You due credit.
Because I shave almost once every 3 to 4 days.
Yeah.
I can't stand facial hair.
And yet he kept it.
And yet Aly was saying, hey, let's keep the facial hair unshaved for the rest of the month. I was like, well, if you're doing it, I'm doing it. So I did it. But guess what happened?
So yesterday, I went to the barber and I just want to get a haircut. And as he lay me at a 30-degree angle and he says, I want to trim your sideburns. I said, okay. And he says, do you want a 0 or 1? And I said, let's just do a 1 on the side here. And he used the electric razor and he went, I freaked out. I'm like, Inky's gonna be pissed mad at me, and I give him all credit. He deserves it. But since there's one strip here, right, I'm not gonna come on air and have
just
one strip here, and
so
he's gonna
shave it out.
So I said, shave it out and let him make me feel bad. Like, it's okay, it's alright. But thank you for supporting men's health. Don't feel bad about it.
I don't feel bad about it.
Don't feel bad about it. I still think you look quite manly, almost like a Japanese guy actually. There's this Japanese look to him. At least he doesn't look like Samuel Hong today.
Oh yeah, that's bad.
What's his name? Sam.
Who?
Who? That Marvel character guy.
Wong lah. The Wong. Wong lah.
Wong.
Wong lah.
Not Wong. The one that does the that ring thing.
Oh, the Shang-Chi guy.
Shang-Chi guy.
The Shang-Chi guy. What? Simi Liu.
Simo Liu.
Simo Liu.
Which you declared you look pretty much like him, and I agree lah.
Yeah. If my wife said, yeah, actually you both look alike.
Yeah, just that now that he doesn't look so much like him, so he needs this beard. Anyway, coming back, hope you guys found this segment interesting with a little bit of comedy at the end. Again, being a doctor is great, but being a nurse has nothing short of being great also. You have a lot of future looking out for you. So parents, do consider nursing as a wonderful profession. It's probably not Nurses Day yet, but let me just shout out for the next year, because this is dedicated to the nurses who are also the core of medical profession. Till then, we'll be back next week on The Two Dogs. See you. Have a good weekend.
Bye-bye.